Welcome to the Ovation Healthcare Learning Institute podcast, where we talk with healthcare leaders about what it really takes for independent hospitals to succeed today. From cost pressures to staffing challenges to changing reimbursement, we cover real-world solutions that help hospitals stay strong and focused on patient care. Listen in for candid conversations, practical advice, and new ideas to help you lead with confidence.
Hey everyone, we're thrilled you're here to join us as we talk about the dynamic landscape of healthcare. I'm today's host, Wanda Wright, Vice President of Payer Relations for Ovation Healthcare. Today we're discussing how value-based care is transforming the way care is delivered, how providers are measured, and how organizations are reimbursed. I am thrilled to be joined today by Bruce Shepard, Executive Strategic Advisor with Ovation Healthcare, who has spent decades helping providers, networks, and health systems design, operationalize, and succeed in value-based programs. Bruce, thank you for joining me.
Thank you, Wanda. It's a pleasure to be here. Looking forward to it.
Let's dive right in. I know some of our listeners may be familiar with value-based care, but just in case some are unfamiliar or need a refresher, let's talk a little bit about what it really means in today's healthcare environment.
Yeah, good question, Wanda. Thank you for the question. And of course, value-based care as an industry continues to evolve. We've been experiencing it as an industry now for 12, 13, 14 years or so, and it continues to change every single year with different programs coming out and us as a provider community evolving on what we understand and how we integrate value-based care. But at its core, value-based care is about improving patient outcomes while using our healthcare resources more effectively. It's really about more proactive care and less reactive care and better integrated care. So instead of being paid for fee for service or volume the way we've traditionally paid as providers for years, under value-based care models, organizations are rewarded for improved, better quality of care, lowering the overall cost of care across the care continuum, better coordinated and integrated care across the continuum, improved patient experience, and of course, improved patient health outcomes as well. Value-based care does show up differently, though, across the care continuum, whether you're a hospital, a primary care provider, specialty care provider, whether you're doing population health things like care management, whether you're building provider networks like IPAs or PHOs or something like that, or providing outpatient care in a hospital setting or otherwise, and even sometimes around medication compliance. All of these are included or can be included in a value-based care model. For rural hospitals, value-based care really represents an opportunity to align care around the needs of the community and to strengthen long-term sustainability of the hospital through the relationships with the payers and the different value-based care models.
That's an important point. Value-based care isn't just a reimbursement model, it is a framework for care delivery. Why is this shift especially important for rural hospitals?
Rural hospitals are uniquely positioned because of their deep community relationships. As we know, many of our rural hospitals across the country depend heavily on Medicare and Medicaid. And many of these value-based care programs are really being driven and initiated at the federal level by CMS. Initially in the fee-for-service program, but then we're also seeing many or most of the Medicare Advantage plans across the country adopt some type of value-based care program as well. So across the care continuum, in a rural hospital setting, we want to look at stronger coordination. So whether that's the hospital, outpatient care, primary care specialty, improved care coordination across the providers, earlier intervention and prevention. It's important to really utilize any data that you may have and proactively identify. Oftentimes your chronic care patients are patients that are high acuity or even patients that are rising acuity so that we can catch them early and manage their care process. Better chronic disease management, I just mentioned that, whether it's diabetes or other chronic care. All of the value-based programs do include some sort of disease care management, specifically around diabetes and heart disease. More effective use of limited resources. Again, I mentioned earlier about proactive care instead of reactive care. And it's about making sure that we get the patients in that we know that need the care and treating them on a proactive basis.
What do you see as the major challenges they face when trying to adopt value-based care?
Yeah, great question. And I would say that I think every hospital, every provider across the country is trying to figure out exactly what it means. And more importantly, what it means within their organization, because it is very different in every organization. Depends on your community, your resources, your current situation, all of those things. I think even more complex for rural hospitals, just given the limited resources and unique pressures that we face in rural America and with our rural hospitals. And some of those, not all of them, but some of them are certainly limited data and analytics infrastructure. In a value-based care environment, it is all about the data. So the more data you have on the condition of your patients, what's going on with your patients across the continuum of care, having the ability to aggregate all of that data into one place is really critical as far as success in value-based care. Of course, that requires resources, sometimes financial. There are low-tech approaches that can be implemented to start value-based care models. So you don't necessarily have to go invest a lot of money in data out of the gate. You just have to know how to start that process. Resource constraints, certainly, which requires a very strategic implementation to ensure long-term success. Again, I just talked about data. There are low-tech approaches that you can use on data and then expand your resources on the data side or technology side as you get more complex in your value-based care journey. But also with staff, just having the staff in our rural communities and the talent that we need to manage these programs and be successful at them sometimes is a barrier for our rural communities. Challenges with provider alignment and engagement. I was actually just with a hospital yesterday meeting with some of their providers, and it was very interesting discussions. Again, just everybody's really trying to figure out what value-based care is all about, including our physicians. So in a value-based care environment, it's incredibly important that we bring our physician partners along this journey with us and make sure they understand what value-based care is and what it is not. Our success in value-based care will hinge upon the physician involvement and including their staffs as far as the workflow and those kind of things. Workforce shortage and competing priorities. Again, I've already talked about talent in our rural communities, but we're all facing a lot of pressures financially and otherwise. So it's just difficult to get the talent that we need. Limited number of patients in our rural communities. And so one of the biggest opportunities financially in value-based care models is shared savings types of programs. However, with those types of programs, you have to have a minimum number of attributed lives to be able to access those programs with the payers. Many of our rural communities just don't have the density of the population to be able to do that. So it becomes necessary to oftentimes to partner with other communities to really advance in the value-based care journey. And last but not least is just a growing list of programs from CMS that's requiring hospitals and providers, in some cases including specialists, to own financial risk and patient outcomes and total medical costs. And we've seen that continue to progress over the past couple of years. We've seen CMS release a few new programs just in the last 6 or 8 months that are going to require more downside risk and financial ownership by us as a provider community. And all indications are that's going to continue to progress. So it's important as a provider community that we start now to try to figure out how we can be successful under these models, so that when that time comes and we are required or do decide to take on downside risk, that we're doing it and we're prepared to be successful under that model.
Wonderful. That brings us to Ovation's role. Through our shared service model, we support hospitals and health systems of all sizes, and that is no different for value-based care. Can you walk our listeners through Ovation's approach and how we meet our partners at any stage of value-based care readiness?
Yeah, thank you, Wanda. This is a new program for Ovation as we seek better ways to serve our hospitals and our partners throughout the country. With the growth of value-based care, certainly we want to leverage our Ovation resources to help our hospitals and providers in this journey as well. As we develop these programs, there's several different things that we can bring to the table to help you. The first one I would say is I'll just say a turnkey solution. So if I mentioned this earlier, but if there are hospitals that are in the same state, usually that have an interest in coming together and building a network, then certainly Ovation has expertise in building those networks. We know how to do that. We can guide you through that. We can come alongside you and help you do that. If you don't know of other hospitals that are interested, then we can certainly help you build that network as well. But oftentimes it's important to partner with like-minded rural facilities across the state to create that bigger, broader network, and then work on value-based care together and go do your contracts with the payers as an entity. But again, that's just kind of an example. We want to come alongside you and figure out where you are in this journey. And the turnkey solution is one way that we can do it and completely help you build the entire program. From a management or advisory services standpoint, that's another way that we can assist you or help you. What that looks like from a management perspective is if you do or don't have a population health director or somebody in that type of role within your organization now, Ovation can hire that employee on our payroll, put them on site at your organization, and then we can manage that entire program for you. If you have somebody that you have in that position now, but just would rather have the management of the program outsourced to the Ovation team that has the expertise in how to run and be successful in these programs, then we're happy to take that staff member on Ovation payroll and really manage that entire program for you, whether it be strategy, physician education, payer contracting, operational strategy, across the entire gamut of the value-based care platform. From a management perspective, if you don't have an interest in us employing that director, then under our advisory services, we could do a contract with you for a certain amount per month, a monthly fixed rate, and then help you again with all of those different components of the value-based care program. Again, strategy, education, payer contracting, operational processes, creating and forming a distribution plan, physician education across the board. The next thing is strategic design solutions. Again, whether you're doing value-based care or not doing value-based care today, we can come in and do a very thorough assessment for you, either a feasibility assessment or a performance assessment, depending on where you are, and really analyze where you are within the organization as far as value-based care and make strategic recommendations back to you on how to grow or be more successful in value-based care. And last but not least, we're developing a shared services suite. So often in these value-based care programs, there are things that you need to implement. They can be done internally or they can be outsourced. And that's things like chronic care management, care coordination, remote patient monitoring, and those types of things. So Ovation is building a shared services suite with preferred partners that we can bring to the table to provide many of those services for you. They're trusted partners that we worked with and that we know they'll add value to your program and help you on that journey.
So for those who may not be looking to bring on a strategic partner for value-based care, let's talk about the foundational elements that make it work. What would you say are the key components of a successful strategy?
Yeah, this is really this is a fun topic and a lot to kind of unpack here. So thanks for asking the question. There are definitely some essential components to really drive optimal outcomes in a value-based care program. And so we'll kind of walk through some of those that around provider engagement, financial performance, and value-based care. So lots of things to think about. First and foremost, and I've mentioned this already, is physician engagement. If your physician community is not fully engaged in these programs, then you certainly are not going to optimize the availability that exists with these programs, whether that's improved patient care, improved processes, incremental revenue from the value-based care programs. Having that physician engagement is absolutely critical to success. And if I had to get rid of everything but one thing on this list, I would say physician engagement is probably that thing that you have to ensure. Driving deeper on the physician engagement piece, it's important that you really early on identify a physician champion so that physician champion can better understand the details of value-based care model and really the why behind we're evolving as an industry. Then that physician champion or provider champion can then help you bring the rest of your medical staff or the rest of the group along the journey and help you with some of that education and buy-in. Provider accountability across the continuum of care. This is another key component, and I just talked about how important it is to have physicians engaged in the process. But I would also say that as the program evolves and gets more sophisticated, the value-based care program and the way it's structured financially from an incentive distribution standpoint has to hold providers accountable for meeting the metrics that are agreed to in the value-based care program. whether that's our hospitals, whether that's our PCPs or specialists. Once metrics are set, the distribution plan for any revenue earned has to flow back to some portion of it has to flow back to those providers. And if those providers that are doing very, very well as far as meeting their quality metrics, they're engaged in the process, and they have a large patient panel, then they should be rewarded for that through a higher portion of the dollars that come from the incremental revenue. So we talked about rewarding the high performers. There must also be a process. In fact, for our clinically integrated network, this is part of the FTC requirements, that there be a process to hold providers accountable up to and being removed from the network if they're not engaging in the process and really helping to improve quality and patient care. Accurate and timely analytics for reporting and patient risk management. Again, early on, we talked about the importance of analytics. That really has to drive everything that you do in value-based care program, not only on the front end for looking at what patients we focus on, what patients are driving the cost, what disease states or procedures are driving the cost, but also on the back end from a management and reporting standpoint. Management needs to have the ability to have dashboards, KPIs, those kinds of things to manage the program, and then report out to hospitals and providers on how they're doing at the provider level as far as success and metrics in the program. A thoughtful incentive distribution plan, very, very, very important. There is a legal component to this, and certainly some stark and anti-kickback implications with this as well. But you have to make sure there's an incentive distribution plan that incentivizes high performance, and the inverse of that, again, does not reward low performance. Strong care management and infrastructure. Again, going back to the analytics and the data, once you identify the patients that are high risk or rising risk, then having programs in place, care management, care coordination programs in place to properly manage those patients and engage these patients in the care journey, incredibly important to success. Committed leadership with a long-term vision and strategic implementation plan. As far as committed leadership, it's important that our leadership, not only from a hospital standpoint or healthcare leader standpoint, but also physician leaders, really understand what value-based care is and is not, and the long-term value of these value-based care models so that they can commit the resources and drive success of the programs. Technology integration, again, super important that we connect our EMR systems. And again, there's ways that can be done this out of the gate. There's ways that we can do this out of the gate that are less costly than other options, but technology integration across multiple EMR platforms and often state health information exchanges is super important. And last but not least, a culture of continuous quality improvement. And that's on the hospital side as far as inpatient, outpatient, but also across our primary care and specialty practices, and really focusing the workflow and priorities within the care continuum around quality improvement.
Okay, great. Thank you, Bruce. That was a lot to package together and a lot of great information. Do you have an example of how you've helped a hospital leverage this approach?
Yes, we do, Wanda. Thanks for asking about that. Happy to talk about that. Absolutely. So we've partnered with a multi-hospital system that had a number of independent providers across a regional area, really to design and launch a clinically integrated network initially, and then eventually a Medicare ACO as well. But the clinically integrated network and the development of infrastructure for that really served as the foundation for the region's value-based care strategy. That incorporated 5 hospitals and approximately about 700 providers, physicians in multiple specialties, some 42, 43 different specialties. The development of the clinically integrated network that I mentioned really started with the formation of the network. So that was our hospital partners, our primary care providers across the region, our specialty physicians and providers across the region, which ended up including some 42 to 43 different specialties. We did set up the governance structure as well, and the governance structure for these value-based care networks should be heavy physician driven. I would say as a side note that if you're actually going to form a clinically integrated network, which is a defined network by the FTC, There's some requirement regarding governance structure and physicians being involved. So again, something to think about as you develop these networks, and another area that Ovation can help you in. Performance operation to drive measurable clinical and financial improvement, along with incremental volume and revenue to the hospitals and providers. So as we built the network and negotiated the payer contracts and started getting operations in place, really using that data and driving the program, we were able to drive measurable incremental volume into our primary care practices for screenings, for annual wellness visits, and those types of things, which then in turn drives incremental revenue and volume to our hospitals and specialty providers as well. Through the development of those programs in the last full year, we generated just over $15 million in value-based care revenue across 5 payer contracts. That was Medicare fee-for-service, Medicare Advantage, and commercial contracts as well. If you look at the number of providers that we had in the network, specifically primary care providers, that equated to almost $80,000 over a 6-year period to our primary care providers on average per provider, and about $2.7 million in incremental revenue to our hospital partners. And so if the operations are set up well, focus is there, there's a good operational strategy in place, and the hospitals and the physician providers are truly working together and integrating care and integrating processes, there certainly is incremental revenue opportunity in these value-based care programs. One of the other benefits we saw from this process was improved alignment from our hospital community and our independent community providers. Having these programs in place and really developing and working on them together as a network, it aligns incentives and really allows for close integration and close partnership, and out of that, relationships develop as well.
All right, that brings us to the end of this episode. Thank you so much for your time, Bruce, and thank you to our listeners. We hope this conversation helped demystify value-based care and offered practical insight into how hospitals can build sustainable success. Don't forget to follow us on LinkedIn at Ovation Healthcare. If you'd like to learn more about Ovation Healthcare and any of our shared services, please visit ovationhc.com.